And think about that the teeth don't exist in space. They actually exist in jaw bones, which is the upper maxilla
Mhm.
and the lower mandible. And the maxilla holds the upper teeth, but what people don't realize is the maxilla and the mandible, which holds the bottom teeth, are actually form the bony borders of an airway. Okay.
The bony borders of an airway.
Right.
Say that 5 times
Okay,
fast.
right. The bony borders of an airway. So we know we have this is how we can get air into our body. We can get it in through our nose, right? Or our mouth. But we're really supposed to be breathing through our nose at least 90% of the day.
Mhm.
Okay. And that is super important because only when you're breathing air through your nose are you filtering it, warming it, and preparing it to hit your lungs. Okay.
Okay.
We also have sinuses that release chemicals or enzymes that help purify that air and are actually a natural antiviral. Okay. You don't get that by breathing through your mouth.
So mouth breathing is not the best way.
It is not. And if you look around,
We
so
probably heard that, but I
yeah.
mean, but I
Well,
never heard that explanation of the sort of purifying and
well, we were meant
the
to have a
processing.
nose, right? We have a nose for that reason. Our nose is the filter from the outside to the inside. If you think about it, we can breathe through our mouth, but that's not how we're supposed to breathe.
Mm.
Okay. So if you know that your nose is your primary filter, okay, and you also know, here's another little fact that the bottom bone of your nose is the same bone as the top of your mouth, the palate.
Okay.
Okay. So that's part of the maxilla. Now, if you have crooked teeth, instead of saying, why are my child's teeth not fitting or why are they crooked? Instead of saying, let's take out the teeth to make them fit together. If you look at how the body mechanics are supposed to be, why is that crowded? It's crowded because your maxilla, your upper jaw, is too small. And what are the implications of that? Well, a smaller maxilla, upper jawbone, is a smaller nasal cavity. And simple question, if you wanted to breathe through something that was like a little stirring straw or something that's like a garden hose, what would you
The
choose?
garden hose,
A
of
garden
course.
hose, right. So then if you take that a step further, we forget about how important our tongue is. Okay, I'm using my tongue right now to talk. And that leads to, how many kids or parents have their kids in speech therapy. But our tongue, while we're awake and asleep, should really be fitting in the roof of our mouth, our palate.
Mm.
So we have to have room for our tongue to fit. So we have to start looking at making the shape of the oral cavity big enough so you have a healthy nasal cavity and room to park your tongue. Because when you don't have room to park your tongue and you go to sleep and you don't have gravity in your favor, that tongue, because it can't fit in its parking space, I like to say, will fall back into your throat.
Mm.
Okay. And that can cause some snoring, leading to sleep apnea. The other thing, the
I think
reason,
you're describing my night of sleep, by the
well,
way.
I'm describing,
A
unfortunately, I'm
lot of people.
describing, so sleep apnea, obstructive sleep apnea, is a modern day disease.
Mm.
It didn't exist.
Wow.
Well, think about it. And that's what goes back to me talking about taking a pill or getting a breathing machine, a CPAP. We fortunately have so many advances in medicine that allow us to stay alive. Okay. But it's the difference between lifespan, okay, like how long we're going to live, and health span, meaning at what point in your life trajectory are you starting to need all these medications? How healthy are you during that lifespan? That's your health span.
Mm.
Okay. So sleep apnea, and you can't listen to a radio program, you can't watch TV, you can't without hearing something about snoring or sleep apnea. But that is an end stage disease. And it starts with, so every adult that has some sort of sleep disturbance or sleep apnea was once a child that had very small, underdeveloped jaws, no room for their tongue, and had very early symptoms, with the earliest being mouth breathing and probably snoring
Mm.
and some restless sleep. So you don't just turn 40 one day and have sleep apnea. It's been a progressive, and you want to get it while basically the structures, your airway structures, are forming.
Mm.
Okay. And ideally, that is before 6 years old.
Hmm. Now let's get back to the cavity
Yeah.
analogy or reality. of that. So we have the traditional way, to
Right.
fill it. The air pathway approach, how would that look?
Okay, so that's a great question. So I've been a dentist for, oh gosh, 24 years now and a pediatric dentist for 22. Okay. And in my career, and I was guilty of this too, I would treat kids that have cavities for obvious reasons, right? Home care, diet, terrible. But I also ran into patients that said, parents were like, I don't understand. We do everything right. We're eating well. Are we perfect? No. But, every night we're brushing and flossing together and trying to keep a low sugar diet. And they're not eating soda and juice in between meals. What's happening? You know what's happening? Breathing through your mouth.
No kidding.
Yeah. It dries your mouth out. So saliva is like the protective juice that we have. That's the first step. So whenever we eat anything, our teeth are going to go into a danger zone. Our mouth becomes acidic, but our saliva within 15 to 20 minutes helps neutralize that and stops the breakdown of teeth of enamel. But if you're breathing through your mouth, you're drying your mouth out completely, meaning all the plaque and carbohydrates is getting stuck onto your teeth and you're sort of like air baking it. Okay. So people who usually have sleep issues also wake up with a dry mouth because they've been breathing through their mouth all night.
Yeah.
And then they're breathing through their mouth all day. So they're not getting that protective juice around the teeth that we call saliva. And again, so that's another way of looking at it. Like we know the basics of not getting cavities, right? Brush, floss, don't eat
But
a
we're
lot of
told all the
sugar,
time. Yeah.
right? Okay. But who are the other people? And I'm sure you've known them, talking to your sister, or your sister would agree, that just don't understand why they're getting cavities.
Yeah. They're doing everything right.
They're doing everything
They're even
right.
flossing.
Right. Right. So really
Using
what
the
this
toothpick.
is a better approach than airway is function. Like I even like the people are starting to relate and hear airway dentistry, but dentists are not responsible for curing the whole airway. We're an important spoke in it. And pediatric dentists or dentists that work with very young kids, and I wish more orthodontists would do it, who start to get a kid's jaw structure. So I think I said, so the maxilla, the upper arch makes the basically the volume of our nose. And then depending on where our upper jaw is positioned, our lower jaw is going to be positioned. So this is not my quote, it's from one of my mentors, but that the upper jaw, the maxilla is the criminal and the mandibles is the victim. Okay. So our airway, we know where our airway is, our throat, right back here. So depending on where these jaws are in space, if they're really back, like if you have a protruded mandible, right, where you may look like you have buck teeth, okay, but your mandible's really pushed too far back. That is making your little breathing tube, your posterior airway, your posterior pharynx smaller. You bring that forward, you're making it bigger. So a lot of sleep devices that adults use, which can be life-saving and life-changing, which are like something called the mandibular advancing appliance that helps bring your jaw forward. These are the same thing as those boil and bites that we, hear advertised all the time. They're bringing your jaw forward. But what if in the earliest years of growth, we could figure out why we're not growing the way we're supposed to be optimally and help that child grow into that position? Not going to say that it's going to cure everything. I don't know, but it's sure going to make it better.
So this came to you not as a dentist, but as a mother.
As a mom.
So it was a drastic change. I mean, anyone who knows your family and knows the history of your family knows that it is traditional dentistry that has gone back generations. And you started in that path and many, many years on that, traditional path. And then all of a sudden this pretty dramatic
Shift.
shift from that. So tell me how that began.
Yeah, it really did come from being a mother. So, I mean, in my pediatric dental career, in order to be a board certified pediatric dentist, there's certain guidelines and rules we have to follow. But what's interesting is if you look at the definition of what a pediatric dentist is, they're also they're the ones that they're supposed to manage the growth and development of the child's oral facial cavity. Okay, so just put that aside for a minute. So here I am doing my dentistry, loved it, love working with kids in this way, love getting kids through difficult, procedures to the other side. At the same time, I have my two other children who at this time are, I think, let's see, my son, I think, was 9 and my daughter was probably 7-ish. And ever since my son was born, and let me just get to the end, they're healthy, thriving kids now. But ever since my son was born, um, his health was such a huge part of our family dynamic. And it actually all started because I couldn't breastfeed correctly because he had a tongue tie. But I didn't know this. I was actually in my residency. Okay. But that led to 3 years of, doing GI studies, doing all these extra things, having his tonsils and adenoids out at 3.
Oh
And
my.
I didn't even know why at that time. It's just we were in and out of the hospital so much that um it was just like, this is what's going to happen. Okay. And then, he sweetest boy in the world, but he was really spacey, sort of hyperactive. Not the normal hyperactive, but I remember when he went to camp once, he came back and he said, "Oh, my counts are so funny. He calls me Earth the Jack." But what he was hearing is somebody was saying, "Earth to Jack, where are you?" Right? And a similar story for my daughter. So, as dentists, we go to continuing education all the time, as we should. So, I think it was 2016, um, at a huge dental conference in Boston called the Yankee Dental Conference. I went to a lecture that was about early orthodontic treatment and airway.
Mhm.
And I was like, that's interesting.
That's
I want to do
interesting.
something new. Right.
Mhm.
And the interesting thing is my father, Lewis, was signed up to go with me, but he realized he double signed up for something. So he said, I'll go to that other class. Well, that lecture was 3 hours and it started with um, them presenting pictures of kids' faces, no teeth yet, just pictures of kids' faces, and then reading either a report from a pediatrician or a therapist or a school or a parent about what was going on with that kid, right? Speech issues, oppositional defiance, not sleeping, won't go to bed, picky eating, all these things as parents that we are going through, get sick all the time, can't lick it. There's something that all of us with parent as who have children who thankfully have within normal limits of health, but there's these little bugging things that we've gotten so used to that are common but not normal. And when this doctor then put it all together about how it all goes with basically how well we're breathing and sleeping
Mm.
and the impact that dentists can have as part of that puzzle, because especially dentists that work with kids young when they're growing, to change the structure, you can start to change basically the quality of life for the child and for the family who's raising this child. And it hit me like a lightning bolt because almost everything they were talking about was in some way related to what I was going through with my own children. And I just couldn't put my finger on it. If I've learned one thing, it is to always, always, always listen to parental, and no offense, John, maternal instincts.
Mm.
Moms, no. And moms sometimes just don't hear the answer that makes sense to them. So they keep looking and they keep searching to find an answer. And it it became, I don't know, it was a breakthrough moment. At times it felt like a breakdown moment, but it was a breakthrough moment to the point where I ran out of that class and I found my father, my uncle, my husband is also a dentist. And I said, everything's changing. Like I can't do things the way I normally do anymore. They're like, what are you talking about? But just seeing it from a totally different
Lauren, what are
lens.
you saying?
Yeah. Oh, yeah.
I'm sure.
And
Yeah.
it's one of those things that once you see it, you can't unsee it. And then once you start to see the changes it's making in your life with your own children, and then you start treating some more children and some more children with this type of approach, and hearing the stories that you're hearing back about the quality of life that's improving. They're sleeping again, they're not as hyperactive, because the symptoms of ADHD and ADD almost completely mimic the symptoms of restless or poor sleep in a child. I'm not saying that dentistry cures ADHD, and I'm not saying it's not there, but I'm saying if your body isn't working functionally, if you're not sleeping the amount of time in a restful, deep sleep, getting into all your sleep stages as a child, when you need that more than ever, I mean, you are at the highest amount of brain growth. You need deep restorative sleep. You need to get into those deep levels of sleep. And if you don't, you are not at your best, period. We're like that too. But kids are really chronically sleep deprived. There's lots of reasons. It can be, they're up too late on a tablet, blah, blah, blah. But there are kids that go to bed at a certain amount of time, sleep the recommended hours, and wake up, and they wake up tired, and they're tired during the day. And think about child. When you have children, when they are at their worst and you say, "Are you tired?" What do they say?
No.
No, absolutely not. Right? Even when you know that they're
Not a
tired.
chance.
Nope, nope, not tired. And that's when you know that they're overtired. So adults, we have the benefit of drinking coffee, right? We have been living with restless sleep and non-restorative sleep for a long time. We may describe it as sleepy. Kids have a paradoxical reaction where they're actually hyper. They're hyper because they don't want to miss a minute. They don't want to say they're sleepy, right? And the way it was described to me once is, if you're driving a car and you're sort of falling asleep, what do? You roll down the window, you start tapping on stuff, you start doing things and moving to keep yourself awake.
Yeah.
And that's sort of the same thing that you can think about with a kid, but they're sleep deprived. So again, I think some of the questions we should be asking is why. So whether it's dentistry or medicine, why? Why is this happening? We still might have to treat the symptom, but maybe we have to treat it differently or less, or for a less amount of time if we understand why, right? So those are the questions. I even think kids that are having trouble in school concentrating, they should have a sleep screening. I'm not saying that they shouldn't be put on medication, but we should find out what's going on.